Hi, this is Mr. Hove from Bluefin Vision. The video today is about what is lens replacement surgery. So, first and foremost, lens replacement surgery is done in patients who now need to wear glasses or contact lenses. Typically, they're above the age of 40 and they're having surgery to replace the natural crystalline lens in the eye, which is losing its elasticity, and therefore they're needing glasses either for presbyopia or they're already in their 40s and 50s, potentially want to have laser eye surgery, but I've explained to them that lens replacement surgery would be a better option because possibly laser eye surgery will leave them needing glasses to read. So, lens replacement surgery is very similar to cataract surgery in that we're removing the natural crystalline lens from the eye, and typically we're putting in a premium lens, typically a trifocal lens, and that will give them good distance, intermediate, and near vision to stop them needing glasses or contact lenses. The actual operation takes about 5 or 6 minutes per eye, with about a 5 or 6 minute in between period, so 20 minutes to do both eyes. It's done in theatre in hospital. The recovery is 2 to 3 days, and the patient is often without glasses after the operation. Thank you.